Welcome back to this module. Welcome back to this course. We are gradually coming to an end of this course. And today we'll be looking at module 9, the human element. We're looking at health, finance, and resilience. Now, for the module objectives, by the end of this module, you'll be able to learn to understand the importance of mental and physical health disaster during physical health during the She able to understand financial coping strategies to navigate through emergencies and recovery. Is able to develop strategies for psychological resilience, particularly in high stress environments. Is able to learn how to support oneself and others during post disaster recovery. Now let's look at the health balance, maintaining mental and physical health. Now, what are some of the importance? The importance of health in disasters. Disaster cause extreme stress, compromise access to food, water, and medical care, and it threatens physical and mental well-being. Now, what's stress management? Stress management involves deep breathing, it reduces your heart rate and calms the mind. There should be mindfulness and meditation. It helps reduce anxiety and improve emotional regulation. There should also be positive visualization. Mentally rehearsing calm environment enhances resilience. You can also practice positive visualization. Mentally rehearsing calm environment enhances resilience, like I said. Then you can also have structured routine that will provide stability and control over the situation. Therefore, hygiene and disease prevention. It should be hand hygiene where you wash your hand frequently, use hand sanitizers when water is scarce. Then there should be safe sanitization, dispose of waste properly, and maintain clean living conditions. Then there should be oral hygiene that prevents oral infections even under resource limited conditions. Then under nutrition and hydration, there should be high energy foods, stockpile calorie dense food such as nuts, dried fruit, and canned protein. Then for hydration, you should ensure adequate water intake. Now let's look at combining mental, physical, and nutritional practices. Now let's look at managing daily stress. Engage in stress reducing activities like deep breathing or meditation. Engage in hygiene routine. Wash hands before meal. Maintain oral hygiene and rotate your clothing. Now let's look at the structured nutrition. Plan portions of nutrient dense, shelf stable foods. Then let's look at observation and early action. Monitor for symptoms of illness, dehydration, or malnutrition and take immediate actions. For practical recommendations, practice 5 to 10 minutes of mindfulness, breathing, or stretching multiple times a day. Prioritize hygiene practices and food conservation to maintain health. Monitor for signs of dehydration, exhaustion, and infection regularly. Now, how do you cope financially in a crisis? Managing your finances during a crisis. You have emergency funds, you have digital or physical asset protection, you also have insurance coverage. Now, for emergency funds, the principle is to set aside 3 to 6 months of living expenses for emergency. Always set 3 to 6 months ahead. Then accessibility, store funds in easily accessible accounts for quick withdrawals during crisis. Now there should be consistency. Contribute regularly, even small amounts, to gradually build the financial safety net. Now for digital and physical asset protection. For digital assets, maintain access to bank accounts, investments, and payment systems. For physical assets, secure valuables like cash, jewelry, and documents in fireproof or waterproof safes. Now, for asset protection, the tips you should do is what? Regularly update backups and ensure physical and digital security measures. Now, for insurance coverage, we have insurance coverage. For the types of coverage, we have you have to understand the property, life, and disaster specific insurance policies. Then there should be adequacy of coverage. Review coverage limits to ensure that they reflect the value of assets. There should also be policy updates that will keep insurance policies updated and accessible. Now let's look at financial strategies during disasters. The one we looked at before was the coping strategies. Then you are looking at the financial strategies here during disasters, what you should carry out. Number one, budgeting. Prioritize essential expenses and reduce discretionary spending to conserve resources during crisis. Two, you should have diversified income. Consider multiple streams of income or contingency plans for businesses to sustain operations. Three, carry out resource management. Conserve cash, food, fuel, and other essentials to extend the effectiveness of emergency resources. Then there should be communication. Keep updated contact informations for banks, insurers, and financial advisors to ensure rapid assistance. Now, what are some of the psychological um, resilience that is coping with trauma and loss, or trauma of loss and displacement? Now, let's look at understanding trauma responses. We have acute stress reaction. This is fear, confusion, hypervigilance immediately following a disaster. We have PTSD, that is post traumatic stress disorder, such as flashbacks, nightmares, and avoidance behaviors that interfere with daily functioning. We also have anxiety and depression. This is heightened worries, sadness, and or hopelessness. Then we have sleep and appetite disturbance. We have difficulty sleeping or eating exacerbates stress. Then we have building personal resilience. Yeah, let's look at this. Now, the component is social support, staying connected with friends, families, and support groups. Then we have goal settings, you breaking down challenges into manageable steps and celebrate small achievements. Now, let's look at hope and optimism. This focuses on controllable aspects and remind yourself of recovery possibilities. Then, under building personal resilience, you also have self care practices where you practice your rest, exercise, and proper nutrition that enhance physical and emotional endurance. Now, let's look at the community and social support for resilience. Then, we have peer support groups where you share experience and solution to common challenge. Then there's community programs that you organize rebuilding and initiatives, volunteer efforts, and group therapy sessions. Then we have mutual aid networks where systems are created where neighbors support each other with resources. Then with childcare and emotional support. We also have professional support access where that ensures individuals know how to assess counselors, psychologists, and crisis helplines. Now, what are some of the psychological recovery strategies? You have to first recognize and name your emotion. This is the first step, awareness. Then engage in supportive activities, talk with trusted individuals, participate in group sessions, or join peer support networks. Then you seek professional help. Encourage access to counseling and psychiatric services when symptoms are severe or persistent. Then maintain a routine, provide a sense of normalcy and stability by sticking to a daily structure. Then incorporate mind body techniques. Use techniques like deep breathing, yoga, and muscle relaxation to reduce stress. Now, what are some of the long term resilience and recovery? Monitor your progress, periodically assess mental health and emotional coping, adjust your strategy, modify techniques based on changing circumstances and needs. Promote education, train communities and leaders on recognizing trauma and supporting resilience. Foster empathy and connection, encourage supportive relationships and community cohesion. By way of conclusion, this module covered health, finance, and resilience as the cornerstone of personal and community recovery after a disaster. It emphasized the importance of maintaining a balanced approach to both physical and mental health, as these are critical for long term recovery and well being. This module also highlighted the need for securing financial stability during and after a disaster, ensuring that individuals and communities can meet their immediate needs and action and plan for the future. Lastly, it focused on fostering resilience, developing the mental and emotional strength to adapt, to recover, and to grow stronger in the face of adversity. By addressing these key areas, individuals can better navigate the challenges of post disaster recovery, while communities can build a foundation for sustainable recovery and future preparedness. Now, for the assessment session, there's 15 minutes multiple choice questions. Then there's also a short report where you do for proper understanding. I'll see you in the last module.